Thanks for tuning in to Vitality and Motion. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits in your life and check in with your healthcare medical providers as you feel is necessary. Hey everybody, welcome back to another episode of Vitality in Motion. I'm your host Maddie, and today I wanted to discuss with you the shoulder complex, give a little overview of what the shoulder is, and then how the shoulder moves specifically overhead to either help guide your workouts better or maybe give you a better idea of where your pain may be coming from, especially if you do have trouble with lifting your arm overhead. And the shoulder is a very complex joint, and it's probably one of the most common things that we treat in the clinic. So with that being said, it's a ball and socket joint, meaning it can pretty much move in each plane of motion, whether that's forward, backward, out to the side, rotate, in and out. And then the shoulder joint itself is made up of many tissue structures within the joint. So for example, there are ligaments, which are bone-to-bone attachments. There's tendons, which are muscle-to-bone attachments. And then there's muscles, obviously, attaching into that structure as well. So a joint is essentially where two or more structures or bones come together to help with movement. So in this case, the shoulder joint is made up of the humerus, or what we know as the upper arm bone, the scapula or the shoulder blade, and then we also have the clavicle or the collarbone. All three of these bones come together to kind of form that shoulder joint. Now for this next part that I'm explaining, I would recommend pulling up the visual that I linked in my show notes so you can kind of get a visual as I'm explaining this. So for the humerus, it has what we know as, or what we call the head of the humerus, or it's a ball-like structure that fits nicely into the shoulder blade. The shoulder blade kind of has like a cavity-like structure that it just kind of fits into, and that's where we get the term ball and socket. And then on top of that sits the clavicle or the collarbone that attaches into the top of the scapula or the shoulder blade, forming a roof-like structure over the head of the humerus. This is going to be important when I'm explaining things later in the episode. And the shoulder joint itself is more focused on mobility versus stability. However, it does need both to kind of balance it out. And when I say mobility, I mean more so there is more movement at the joint compared to other joints. And then the stability aspect comes from the tissue structures like the muscles, the tendons, and the ligaments kind of holding that joint in place. So for this episode specifically, I did want to dive in a little bit more and emphasize the stability part of the shoulder, specifically with what are known as force couples. And a force couple is essentially where the shoulder has two or more muscles pulling in opposite directions to efficiently help the shoulder move overhead or the arm move overhead. And you want to kind of think of it like a pulley. So we have the string and then we have the wheel. If we don't have the wheel, then we're not going to have any stability in the pulley and it's just going to kind of fall apart. Similar to the shoulder, in this case, we're discussing the muscular imbalances. If they're not doing their job, that's when we may run into issues, whether that's from pain or any kind of injury or etc. As I mentioned before, the shoulder joint is known as a ball and socket joint. So that means that the ball or the head of the humerus or that upper arm bone is attaching right into that socket on the shoulder blade, and it's like one big suction cup. So it's able to move in each direction just like a joystick without coming out of place for a normal healthy shoulder. If there's other issues going on like instability, that's a whole other issue. Anyway, if we're talking about a normal shoulder, as the arm is lifting up, that ball of the humerus is rolling up, but it also has to slide down. And if it doesn't slide down, that's when we run into issues because it's going to hit that roof or where that top of that shoulder blade meets into that clavicle. If you're a visual person, this may also help you. If you had a ball and you were balancing it on a board, you don't want the ball to fall off. So you would tilt it with one hand down, you want the ball to roll towards, and then the other hand you want it to roll away from would be lifting up. Kind of similar to the shoulder in a way. Maybe that gives you a better idea. So with that being said, we have two main force couples within the shoulder that provide us with that stability. And the one that helps us with the stability of the shoulder specifically is known as the deltoid rotator cuff force couple. You may have heard of the rotator cuff before, as it's a very common site of injury, and there's four main rotator cuff muscles: the supraspinatus, infraspinatus, the teres minor, and then the subscapularis. And then there is a force couple that is specific for more so the shoulder blade or the scapula, because the scapula also helps to lift the arm overhead. And those muscles include the upper trap, the lower trap, and the serratus anterior. I will definitely link all of these muscles below in the show notes so you can kind of get a visual of what exactly they look like, especially again if you are more of a visual person. But I don't want you to get too hung up on the names. I just want to emphasize that there are a lot of muscles, maybe more than most people think, involved in moving the shoulder overhead. All right, so let's go back to the deltoid and rotator cuff force couple. I'm going to kind of explain what that does, and then I'll explain the other one, and then we'll put it all together. So the deltoid and rotator cuff force couple do help to, their primary job is to help elevate our arm over our head. So the muscles that are helping to roll that shoulder up is going to be the deltoid and then the top rotator cuff muscle known as the supraspinatus muscle. And then the other three rotator cuff muscles, the infraspinatus, the teres minor, and the subscapularis muscle, are pulling down or sliding it down. This helps to avoid what we know as shoulder impingement, which is a common pathology that we will see and treat in the clinic. And essentially what's happening is that the ball of the shoulder is not rolling down, because when the ball of the shoulder or the humerus does not roll down, it's going to run right into that roof that we discussed earlier where that clavicle and that shoulder blade form. So then in turn, it's going to pinch the supraspinatus muscle, which is that top muscle of the shoulder blade, causing that impingement pain. But we can't forget about the upper trap, lower trap, and serratus anterior force couple because, again, like I said, the shoulder complex is very complex. So just bear with me. The upper trap and lower trap, you guys are probably familiar with the location, but the serratus anterior, I feel like, is a muscle that not a lot of people know about or think about. And it's essentially a muscle that kind of wraps around our rib cage and attaches into the shoulder blade. Now, the upper trap will elevate the shoulder blade and the clavicle, and then the lower trap will pull the shoulder blade down and in or medially. And then the serratus anterior muscle pulls the bottom of the shoulder blade out or laterally and then protracts it, which is basically a forward movement, kind of like when you're moving your jaw forward to provide that upward rotation and elevation. So now that we have a basis of what the muscles do, both of these force couples work together to essentially lift the arm up and then elevate the shoulder blade to get the remaining motion of that full 180 degrees is what we typically like to see for shoulder motion. That's considered the normal range of motion. And when we don't have that, or we do have those imbalances, that's when we're going to see those pathologies, or you're going to get pain for whatever reason. You could also have maybe arthritis in the joint, which can affect that. There's many different factors. You could get rotator cuff tears, all sorts of things that can happen. But on a general healthy basis, we want to see those muscles working together to provide that smooth pulley or upward motion. Now, for this next part, to kind of keep things a little more black and white, if it is specifically a muscular imbalance and not related to anything else, which, if I'm being honest here, most of the time is a multifactorial situation, but in this instance, if it is more muscular related, this is where a physical therapist can really come in hand because they can assess your shoulder motion and pinpoint exactly where the functional deficit is occurring and then treat that from there. So, for example, if we see that maybe the first force couple is not working correctly, then what we'll see is that the humeral head is not able to slide down most of the time, causing more so that impingement pain. And it's usually from those three other rotator cuff muscles we discussed, which, like we said, their job is to pull that humeral head down. And that's going to be the teres minor, the infraspinatus, and the subscapularis. Or it could maybe be from the other force couple, which involves the upper trap, the lower trap, and the serratus anterior. Most of the time, we all have pretty strong traps. So it's not necessarily an exercise that you need to be focusing on in the gym. I know guys love to hit upper traps, but I personally feel like it's not as beneficial of an exercise. I mean, yeah, sure, it's going to make you look jacked, but from a functional standpoint and a balance standpoint of that mobility and stability, it might not be the best. And now there's a lot of people out there that are really strong. But if their muscular system is not working efficiently, that's when it causes issues. And that's what we really need to address, or that's what physical therapists usually are addressing. And honestly, that's kind of why I love this profession so much, because we truly are looking at how people move and trying to see if we can help them move better. Anyways, getting back to the second force couple, if we are having issues with the second force couple, most people have really strong upper traps or overworked upper traps. So the muscle that is usually neglected is the serratus anterior muscle. The serratus anterior muscle, I think, is one of the most underrated muscles, just like the posterior tib, like I mentioned on the foot podcast. It's just a muscle that not a lot of people think about to work. And so, in order to try to address that, we want to do exercises that target what the movement is. So, in this case, the serratus anterior is responsible for protraction and upward rotation. So, to give you all some examples, and I'll post videos on my Instagram page so you can see what they look like. But to give you an idea, I feel like one of the easiest ways to describe this is if you went up to a wall, put your arms kind of in like a push-up position, and instead of bending your arms, you're keeping them straight, but you're shrugging your body away from the wall. And I will definitely, like I said, post videos of this. I'll post some regressions and some progressions. And then I'm also going to link one of my favorite rotator cuff series through Thomas Mashad, which I also mentioned before. He's a great resource. And this rotator cuff series, I personally love. I do it all the time to really just isolate those muscles that may be a little harder to hit at the gym. But I want to just say that if you're listening to this and you have shoulder pain right now and it's more of a chronic issue, please do not just dive into doing these exercises that I suggested. Please go get help. Go get imaging, see your doctor. Now, direct access for physical therapy is available, so you don't need a referral from your doctor to go to PT. You can just go directly to PT. Depending on your insurance, I think most at this point are, except for Medicare and maybe a couple others. But, anyways, get the help that you need. Don't wait 6 months from now when that tiny little bit of inflammation could turn into a full rotator cuff tear. This podcast is about prioritizing your health now and not later. So take this as a sign to prioritize yourself now and make that appointment and get yourself the help that you need. All right. I hope you all could understand what I was saying about the shoulder and gave you a better idea of how the shoulder works in terms of the functionality of it. And yeah, I hope you all have a great rest of your day, and I'll see you next time.